Lucia, you may go ahead and start.
All right, good afternoon, everyone. The time is now 4:07 p.m. on October 8th, 2020, and I would like to call this meeting of the Healthy Chula Vista Advisory Commission to order. In the interest of public health and safety and pursuant to the Governor's Executive Order N2920, members of the Healthy Chula Vista Advisory Commission and staff are participating in this meeting by teleconference. In accordance with the executive order, the public may view this meeting online, but not in the council chambers. The city launched a virtual commenting portal, e-comment, which is what Stacy mentioned, that allows residents to comment and participate in the meeting from their own homes. You can find the link to e-comment at www.chulavista.gov/virtual-meetings. Your comments must be received before I call for the close of the commenting period in order to be considered. After the commenting period is closed, I will announce a brief pause to allow the commissioners time to read any comments that have been received. If you have difficulty or need assistance with e-comment during the meeting, please email Patricia Salvacion for assistance at psalvacion@chulavista.gov. Would the secretary please call the roll?
Yes. Commissioner Cruz, Commissioner De Murguia,
Here.
Commissioner Martinez,
Here.
Commissioner Melgoza,
Here.
Commissioner Murphy,
Commissioner Murphy was with us, but she's on via phone, so she's cutting in and out, it says.
Commissioner Quiros, Commissioner Rodriguez,
Here.
and Commissioner Hernandez Nader has requested an excused absence. Thank you.
All right, so public comments is the section on the agenda for members of the public to address the board on items that are not listed on the agenda. I will now call for a 2-minute pause to allow the public to submit any final public comments. Commissioners, as a reminder, please refresh the view on your screen to ensure new comments appear.
Will staff please display the public comment and start the timer?
Apologize, my computer was having some issues there. We do have some members of the public, so if you're interested in providing us any notifications or any other thing that you'd like to make under public comment, the link is up on the screen now.
And Stacy, for me on my end, I'm not able to open the site as I have been in other meetings, so I can't see if there's any comments personally.
Okay, if we do get any comments, we can ask the secretary to read those for us if you're unable to see them.
Okay, thanks. All right, so the commenting period for public comments is now closed. Have the commissioners had enough time to read the submitted comments?
Comments were received. Thank you.
All right, so action items. The first item on the agenda is item number 1. So the election of chair and vice chair for fiscal year 2020 and 2021. The staff recommendation was that commissioners nominate and elect the chair and vice chair for the period of July 1st, 2020 through June 30th, 2021. Does the staff have a presentation?
I do not have a presentation, but we would love it if somebody could make some nominations.
This is Ana Melgoza. I'd like to nominate Alan Rodriguez as chair.
Accept the nomination.
And I second that. This is Lucia Martinez.
If there's no other nominations for chair, you could go ahead and take a vote.
I will now call each member's name, please, for the vote. Commissioner Cruz has not joined us. Is that correct?
That is correct.
Okay. Commissioner De Murguia?
Yes, approve.
Okay. Commissioner Martinez?
Yes.
Commissioner Melgoza?
Yes.
Commissioner Murphy?
Liz,
Commissioner,
oh, hold on one second. Liz, if you're able to write in your vote, that would also be fine. Well, actually, I think we've lost her.
okay. Commissioner Quiros? And Commissioner Rodriguez?
Abstain.
You can vote for yourself.
I'm not going to vote against myself, but
I think Commissioner Murphy has joined us again.
Okay. Commissioner Murphy, your vote, please.
She's on mute, it looks like.
Yeah, Liz, I don't know if you're able to hear us. We're trying to vote on the chair right now, and Alan Rodriguez has been nominated. If you're able to put into the chat your vote. I think that she's having audio difficulties because she's on the road. She has been in correspondence with me via email.
Okay. Okay, very good. We can go on to the nomination for vice chair.
Does anybody have a nomination?
Does anybody want to be nominated? I'm more than happy to nominate anyone. Lucia, would you like to be vice chair?
I can, this is Liz.
Yeah.
Yes, we can, Liz. Were you, how would you like to vote for Alan Rodriguez as the chair for this coming year?
Yes, I agree. I vote.
Okay,
Sorry.
thank you.
I lost audio for a while.
You're okay. Thank you. So right now we have the question of Lucia, if she would be willing to be vice chair.
Sure, that's fine.
If there's no other, oh, we need a second on that.
Second that. That's Maura.
Thank you, Maura. If there's no other nominations, you can go ahead and take a vote.
Okay, I will now call each member's name for their vote, please. Commissioner Cruz has not joined us, correct?
Correct.
Okay. Commissioner De Murguia?
Yes.
Commissioner Martinez?
Yes.
Commissioner Melgoza?
Yes.
Commissioner Murphy? Commissioner Rodriguez.
Yes.
And I just want to confirm that Commissioner Quiros has not joined us yet either.
That is correct.
Okay. So we have 5 votes in favor. Thank you.
And just so everybody is aware, I just wanted to let Alan know in particular that I had asked Lucia if she could run this whole meeting for us, just for consistency's sake. And then next meeting, as the new chair, you'll be running the meeting.
Okay, thank you.
All right, I will now call for a 2-minute pause to allow the public to submit any comments on the item before the commission deliberation. Commissioners, as a reminder, please refresh the view on your screen to ensure any new comments do appear.
Will staff please display the public comment and start the timer?
All right, the commenting period for this item is now closed. Have the commissioners had enough time to read the submitted comments?
Comments were received. Thank you.
Great. Do any commissioners have any comments or questions now? Okay. The next item on the agenda is item number 2, mental health during COVID-19. A presentation will be provided with a summary of current mental health statistics and an overview of available resources to assist families and individuals. Does staff have the presentation? Oh, I see it's up.
So yes, we actually were able to get 2 presenters for today to talk about the perspective from the youth. And so with that, we have Heather Nemore and Violeta Mora with us today to present. And I'll be going ahead and switching your slides for you. So just let me know when you want next slide.
Sounds good. Thank you so much. Thank you for the invitation. Yeti out there that recommended us to work with you on this. So I'm really glad to be here. Both Heather and I were both with the San Diego County Office of Education. We're both with the Student Wellness and Positive School Climate Unit, which we are part of the Student Support Services Department under Student Services and Programs Division. Lots of departments, lots of layers, but we're really happy to be here. Go ahead and go to the next one. So hard to not be in control. There you go. All right, so just to give you a brief overview, a snapshot of San Diego County. Many times when we go out and present or we're at a meeting, we say County Office of Education. Right away, they think it's San Diego Unified, which San Diego Unified is a school district, and it's one of the 42 school districts. So in San Diego County, from San Isidro all the way up to San Clemente to the mountains, the desert, San Diego County has 42 school districts, 783 schools, 124 charter schools, and you know that those charter schools, the number fluctuates. There's many charter schools. They're either chartered through a school district, they're chartered through County Office of Ed, or they're chartered through the California Department of Education. We have over 22,000 teachers and over 500,000 students. So, and we also have 5 community colleges in the San Diego County area. So we're big, huh? We have lots of students, and I believe Chula Vista School District is the largest elementary school district in the state, right, Heather? Thumbs up. Yep. So yeah, you are the largest school district in terms of elementary. So, San Diego County, it's vast. It's a lots of schools, lots of students. Okay, go ahead to the next one. So one of the many things that we do in our unit, the role of student wellness and positive school climate, is that we are here as a unit, as actually the county office. We're here to support our 42 school districts. There's a lot. Sometimes when we go to meetings and we're in training, people often think, well, why don't schools do this and why don't schools do that? It's like, every school has their own school board. And as a county office, we are here to assist our 42 school districts. We provide many different types of professional development opportunities to our district partners, to their staff. Sometimes, right now it's different because everybody is doing some type of distance or some type of hybrid, but we provide this professional development as much as we can. Some of our trainings, we have transferred them over to like a virtual experience, and on the next slide, I'll show you that. But so we're trying to respond to the needs right now of schools, which is the virtual need. We provide technical assistance and consultation. There's lots of, you can only imagine, there's many different laws, lots of legislation that pertains to our students around student wellness and the mental health and suicide prevention. And sometimes schools need some idea, like, what does this mean? So here's legislation. What does that mean for us? What are the mandates? So we really try to work hard and identify the needs, the services, the resources, and that the next one is a service and resource identification. We really try to do that for our schools to make it as seamless as possible. There's lots of great resources. Every community is a little bit different, and the partnerships are very different. So we try to make those connections and make it as easy as possible, so that way we are able to respond to the needs of our students. Another thing is that partnership development. As a county office of ed, and I will say that in all of our different departments and units, everyone has like a services that they provide, different topic areas, different service needs that are addressed. And within our unit, we provide, we represent education in different venues, like YENI, which is Suicide Prevention Council. Both Heather and I, we are co-chairs of the Education K-12 Subcommittee. We're part of the Children, Youth, and Families Behavioral Health Systems of Care Council. We're the education representative. We're part of the Human Trafficking CSEC Advisory Council, which, that meets monthly, and with child welfare, there's other meetings that we're also a part of. So we try to be visible as much as we can, and try to create those partnerships. Where there's partnerships, we try to really make sure that we maintain those relationships, and wherever there's needs, we try to create those connections. All right, next slide. Thank you. So this past year, the 1920 school year, we were able to provide 48 trainings, over 1,400 educators trained. And a lot of those trainings that we see here are the ones where school districts and schools were able to send staff to our trainings. we sometimes have, go out and do trainings, but we really try to centralize our services as much as we can. But right now, it's probably a little bit easier to centralize the services because we're doing things remotely. So around the trainings, we do work around QPR, which is a suicide prevention training. We have youth mental health first aid, which meets the mental health and wellness. There's an anxiety training that Heather and Mara, they provide to schools because that's a huge need of anxiety and youth experiencing anxiety, young students that experience anxiety. So we do provide those trainings as professional development for schools and how to, what are some best strategies in order to meet the needs, the mental health needs of students. There's training around Listen, which is a gay, lesbian, straight education network and creating positive school climate. There's some, the student trends around like human trafficking, CSEC, really looking at what are some awareness training and intervention strategies, providing like those school counselors, school social workers, how best to meet the needs of some of our students that sometimes they get lost in the whole school environments, of how best to reach some of those students. Yesterday, actually, we partnered with San Diego Domestic Violence Council, and it's the Teen Dating Violence Committee, and we're part of that. And we were able to host an awareness training on teen dating violence as another area that we really need to focus on for making sure that our young people are creating healthy relationships. So that's another area around positive school climate that we're addressing. Go ahead and go on to the next one. And we wanted to share with you, this is countywide data on the California Healthy Kids survey. This is done, I believe, I think it's every 2 years. And it is an anonymous, confidential survey of school climate and safety, student wellness, and resiliency. It's administered to students. We gather the information for the ones that are for 7th, 9th, and 11th grade level. There is a core module. There's a core module where students take the survey. There's other modules that may be a little bit more specific around military, violence, just some other specific ones that not all schools take the other modules, but the core one, those are the ones that the schools do administer. And when we pull the data here around suicide, chronic sadness and hopelessness feelings, and I don't have, this is the one that has the 17-19. So earlier today, we did another presentation, and the number for the year of 2015, 2017, for 7th graders, on that first column of chronic sadness, it was at a 23%. And as of 17-19, for 7th graders, it went up to 29%. And the 9th graders in 15-19, it was 26%, and it's gone up to 32%. And for 11th graders, it went from 30% to 34%. So there's this trend in the San Diego County in that area of chronic sadness and hopelessness, that it did go up in these years. Around seriously considering attempting suicide in the past 12 months. For the 15-17 school year, that 7th grade was not, I believe that they were not asked that question. So that data is not available. We see here for the 17-19 that 13% considered. Seriously considered attempting suicide. And then for the 9th grade, it went from 14 to 15. And then for 11th grade, it went from 14% to 15%. It's still an increase. So this is just to provide you some information. It's countywide data. It's not specific to the South County, but it really shows you just overall the trend of just the need to focus some area around suicide prevention. And really, when we do our youth mental health first aid trainings, one of the biggest things that we always reiterate with staff, and sometimes we've done this with parents. Actually, we're going to do our next one, a virtual youth mental health first aid in November with parents up in North County, is always making sure that that students don't lose hope. That's one of the indicators that we really work hard at really in tasking everyone, when you're dealing with young people, we don't want them to lose hope. That's something that's something that we always need to pay attention to, and their behaviors and what they say, what they do, is for our young people not to lose hope. And if you think about it, this data was pulled. This is when students were at school, when things would seem normal, right? And we are yet to know what we're going to see. Hopefully, I don't want to predict or foresee the future, but we just don't know how the impact of COVID, how that's going to have on these numbers when those reports are run again in 2 years. Go ahead to the next one. So some evidence-based guidance for schools during COVID. I know this is guidance for schools, but if you look at the 3 bullets here, these are not just some guidance for schools. We can really take that, because many of you, or many of us, you are probably the teacher now, right? You're working and you're wearing 2 hats. You're wearing a parent hat, and you're also wearing, you're an employee hat. But really taking into account what our students are needing most at this time, and that's that adult person in their life that is able to have a good relationship, that's able to form their relationship. And here it says about relationship at school, but in school setting, think about any setting, is that it's really important for young people to have that adult person that they could always talk to, go to, and have a meaningful relationship where it's really open to talk about things. And if there's things that are happening, that they're able to be that buffer for that young person. Another thing is, during this time, it's really important that there be some consistency, predictability for students at home, especially. So as much as, it's really easy to get into a certain routine, but it's really important more than ever right now. If you think about it, it's setting those schedules and routines at home. Many times I know it's on the weekends, you kind of just you do weekend stunts, but it's really hard when there's no break between what a weekend is and what the weekday is. So that's actually really helpful in supporting our students at home, is as much as we can setting some type of schedule, a designated spot as much as we can of where students, like their area, and respecting the boundaries of school and home life as best as we can. And then the thirdly is building emotional literacy. This is such a trying time. And this is, some of this is, think about pre-COVID, and then now during COVID, building that emotional literacy. They're seeing a lot, they're hearing a lot, they're experiencing a lot. And this is probably the time where everyone, from parents to when we talk to our to school people, it's like as much as you can, those check-ins, if it's over the phone, however way you're able to do a check-in. Even think about people in your own life where you're able to do that check-in. You're physically distancing, but we're not socially distancing, because there's always ways to be able to maintain some type of relationship, be it virtually, be it texting, as much as you can with what you can, right? So in this slide is really important that students have strong relationships, feel that they're safe, and then also build on that emotional literacy. All right, next one. Okay.
I think that's me. I'll try to go quickly because I know we're limited on time. So one of the ways that we have been working across the county to really address the challenging needs that our students are facing is by saturating the 42 districts and getting as many school staff trained as possible in youth mental health first aid, which is very similar to CPR, but for mental health with youth. And so being able to increase school staff's ability to increase mental health literacy, to be able to know what to look for and how to intervene at any comfort level. And so if you can go to the next slide, I'll just briefly share some of the, if you can go one more, sorry. One of the evidence-based outcomes for this are increased knowledge and understanding, encourages people to help other people. And I think there's 2 more you can click on. Supporting people to get help, and decreasing social distance. Next slide, please. And increase mental wellness. So this is what we always share in our trainings, and what it is, it's a spectrum of mental health. And so what what is so important to understand is that there is a spectrum. If we can intervene early, we can prevent a mental health disorder from becoming well to unwell to the whole recovery process. And so we've spent a lot of our focuses in the yellow area, early intervention. So, we're in school with students all day. Staff are well equipped to be able to notice when things are off, when things seem different. And so being able to give everybody the tools in their toolbox to be able to identify and intervene, it can be incredibly powerful for a school or a district. We have some districts that decided everybody is going to get trained on a professional development day, which shows some powerful indicators when that happens. Next slide, please. So a lot of what we spend time on, and not just this training, but a lot of our trainings is, typical adolescence development is such a vulnerable time for youth, and they are going through so many changes, hormonal changes, physical changes, emotional, mental changes. And how do we know? Is it typical adolescent development, or is there something more going on here as parents, as educators, as peer teams? So this kind of gives you a snapshot of the kinds of tools we use. So, withdrawing from family to spend more time with friends. It's totally typical, right? I have a 14-year-old and a 11-year-old, and we're seeing this happening more and more every day. But a warning sign might be withdrawing from friends, family, and social activity completely, right? So they're disconnecting from everything. And so that's when you want to start paying more attention, asking questions. Wanting more privacy, absolutely. This is the age where they start, they want you to knock on the door and they want privacy. That is normal. Potential warning sign is becoming secretive or seeming to hide things and not have that balance. And then moving from childhood likes to teen pursuits, right? So losing interest in some of their toys or games that they used to play, but finding new interests. So when we see our youth losing interest in activities that gave them joy, that playtime, that downtime, and not replacing it with something else, we want to be paying close attention to that. All right, next slide, please. So one thing our unit did is during COVID, knowing our students are now in their home 24/7. And what about those students that are in challenging home environments that don't have nurturing or supportive environments? And so what we found during COVID is that it's really the teens helping other teens. They're texting each other, they're on social media. They are the champions and ambassadors of mental health. If we can train youth and give them the tools and give them the mental health literacy, they are the ones that can be the most powerful interveners. So this was meant to be, we developed this and meant to be in the hands of our youth. So giving something tangible, not for teachers, not for parents, but something for the youth themselves. So on the first page is really, we vetted these, and these are free, and we they're go-tos for all our trainings. So we have a lot of text lines and hotlines on there that they can use, or they can give their friends or peers to use. And we even have the child abuse hotline, because we know child abuse reporting is down, but it's the friends noticing or hearing the stories from their other friends about what's going on. They can make a report. They can make a report. And the My3 app is an incredible free app where they can put in the 3 adult caring relationships that they have. There are 3 go-to people, and they can, when they are feeling down, depressed, whatever it may be, that they can reach out to them and click on their photo and their number. And if those 3 people aren't available, it defaults to the National Suicide Lifeline, where they can always talk to a warm and caring adult. And then there's also a lot of other tools on that as well. The MindShift app is for students with anxiety, and today that's all our students. And so incredible ways to measure and assess your level of anxiety, and specific strategies and tools to dial down the levels of anxiety. And then on the right, these are some self-care strategies for teens that we say during this pandemic, we all need to focus on what we can control. And what we can control is how we treat our bodies, how we're caring for ourselves, how we're protecting ourselves. So these are some top 10 strategies we want to share with youth. And then on the bottom, some more great tools and apps that they can build their own self-care toolkit, and a hope box that Violetta talked about, hope. So put everything in there that gives them hope, and they can use that every day. So this is something we're sharing broad and wide, and the California Department of Ed is sharing this across the state with all the county, and we've shared it with all the 58 counties as well. Next slide. And the last thing I wanted to share, since, I spent, how many years, Violetta? 19 years in my career in Chula Vista. My heart is always going to be in Chula Vista. And any way I can find ways to partner and collaborate with the districts and the district attorney's office, the police department. So we have launched a project called Handle with Care. You might have heard of it in Chula Vista. We're working with the district attorney's office and the Chula Vista Police Department and the districts. And so what it is really looking at a trauma-informed lens and working with students. So if students, let's say they experience something over the weekend, like a domestic violence where the police come out, or a drug raid, or the fire department comes, or whatever it might be, and it could be any level of trauma. And so student comes back to school and is exhibiting behavior symptoms in the class, and often us educators will treat it as a behavior issue, and that just makes the problem worse. So this was developed, so it's based off of Stanislaus County, where it was very successful, where if the ideally all emergency services are a part of this. Right now we have the PD, and I think the fire department's going to come on soon. So if something happens, the officer will put in an app and send a message to the school. Don't need to know the details. All they need to know is this student experienced a challenging traumatic event or challenge, and handle with care. So let this teacher know. They don't know any of the details. Give a little love, extra love and support, and I can't think of the word. Anyway, give an extra love and support, and treat it in with a trauma lens. So that's been being kicked off, and we're continuing to roll that out in Chula Vista. So that's an FYI, and I think we're out of time, so I will open it up to any questions you might have. That's our contact info. And we didn't mention it, but on our website, we have a lot of resources available for the community, for parents, for educators around not just mental health and wellness for students, but for staff, because an anxious teacher is going to create an anxious classroom. And we hear loud and clear from educators across the county is, I have depression, I have anxiety, I'm not well. And if a teacher is not well, how can they go into a classroom and support students to be well? So a lot of our work focuses on staff wellness, and we do have all kinds of toolkits and resources for student and staff wellness.
I think all those programs sound excellent. I did the mental health first aid training for adults personally, and I thought it was great.
Great.
So I think it's awesome that you guys have this going on. Thank you for presenting.
Yep.
Does any staff have any comments they'd like to make before we go into public comment and deliberation?
Hi, hi, this is Mary Cruz. Can you hear me?
Yes, Mary, we can hear you.
Hi. Hi, Heather. Nice to see you again.
You too.
Is any of this being shared with parents? Whether it's the flyers that you showed or the actual classes, so that parents at home can also identify if their child is
absolutely
not well.
Yeah, this is a great question, because we've been working with the 9th District PTA for several years, and I presented their conferences and symposiums, and then we coordinate a lot of the PT presidents from the presentation, then work with us to coordinate a training for their parents at the school site. So Violetta mentioned earlier, we're doing our first virtual youth mental health first aid next month for parents. And we always try to create those opportunities for parents to be able to learn. They should learn the same things that the educators are being trained in. And so when parents take this training, it is transformational for them. And they say, where has this information been my whole parenting life? And as a parent of two, it'd be allowed to do. We use this all the time, every day. So thank you for that. And yeah, getting to our parents. We're right now working on a series with some districts around, I think it's something around cultivating resilience while parenting during COVID-19. And we're doing that for educators and parents. And so just trying to, and doing some statewide webinars with California Department of Ed for parents.
So Heather, this is Stacy. To follow up on that, if that's something that we want to bring to Chula Vista, or do you know if it already is coming to Chula Vista, what can this commission do to ensure that our parents are getting that type of education down here?
Yeah, so it's really for us, it's kind of by request. Who requests it, we will work to make those accommodations and try to meet those requests. So I know in Chula Vista, we had a federal grant. It ended a year ago, but we did go and train parents in several topics around restorative practices, a little bit of youth mental health first aid, and trauma-informed practices and that kind of stuff. But it was with some of the schools that were participating in the grant. And I know we've trained the nurses at Chula Vista Elementary School District in youth mental health first aid. And so like whenever there's a request to bring a group together and to train, and we'll work to meet those requests.
So does that request need to come from a school district, or could a commission like this or a city request that type of training as well?
Yeah, I mean, if whoever's going to promote that training we would need to coordinate the logistics and the promotion of it and all of that and the registration. So usually it's a district that does that, but it could be community. The other thing too is Mental Health America. Wait, is that right? Yeah, Mental Health America does these trainings, and they have contracts to do it, and they're more community based, and they focus on parents and community members. And we met with them and we said, well, we'll focus on schools, educators, and we don't want to take trainings away from you, so you focus on community. So we will pull on them too if there's a lot of requests, because they can do it in Spanish and English as well. But what we do is just try to we give a lot of school examples. I know we trained like all the Girl Scout the parents that are Girl Scout leads in the county. So Girl Scouts coordinated that, and we went and trained them. So yeah, organizations, as long as they do the work to bring everybody together, will accommodate.
Is there if it's going to be virtual, is there a maximum number of people that you're taking? Because I know for the adult one, at least for my organization, they're maxing it out at 20, I believe. So I don't know if you guys have a similar limitation.
Yeah, so it's with 2 trainers, it's 20. With 3 trainers, it's 30. So depending on how many trainers we can get, the one we're doing for PTA is 30 because we have 3 trainers. And so 20 to 30, depending on the trainers availability.
Okay, thank you.
And now virtually it's a different format. So and just another thing that you should know is there were a lot of changes made to the curriculum. And one good change is that they realize that educators don't work 8 hours. So why are they required to go to this 8-hour training? And so they've changed the curriculum to be 6.5 hours for any school trainings that we do. And we provide that same one to parents. So right now you're required to do a 2-hour self-paced webinar, and then they go with us for a 4.5-hour virtual training that can also be split up as well.
Yeah.
Yeah.
This is
Any
Maura.
other-
Yes, I have. Do you do any work with South Bay Community Services? Hello?
Not specifically. Oops.
No? Oh, she's on
Sorry,
No,
not
that's okay. Can't be here.
specifically, like in different probably meetings, like around CSEC, more of like in committees, but specifically like working with them on delivering the trainings, with CSEC, we have a partnership because we do like a multi-agency, multidisciplinary type of training, and also with TDV. So it depends. It depends on the service or the topic.
Okay, I was just curious. Thank you.
Yeah.
This is Anna. I kind of in that spirit, I was going to ask, there's been recently, when we look at the county budget, we see that there's an increase in mental health resources. So my question is there going to be more increased resources for the work you guys are doing around mental health and adolescents? And particularly because of the pandemic, seeing how we can all recover and try to go back to a better new normal and make mental health a priority in our schools.
Yeah, so as a county office of ed, we don't provide direct services, but we our customers are the districts and the schools, and so Violetta, when she covered those slides, those are all the services we provide to the schools and districts, and so we work closely with a lot of partners. So we work closely with county behavioral health, and really, working with the districts to help them understand what school link is and who qualifies, and if they don't, how do they access services? So kind of more help with systems navigation and maybe identification of resources. But as a county office, we don't have specific resources, mental resources that we provide. So the go ahead, Violetta, were you going to say something?
Yeah, there's a legislation, AB 2022, where school districts are required twice a year to notify parents and notify students on how to initiate mental health services, and that could be something that's in writing. It could be something that's in maybe the handbook. It could be something that's posted on their website. So as with legislation, the schools are required to notify and then notify what is available at their school, at their district, or notify what's available outside. So maybe like here in Chula Vista, like who are the community providers. So making sure that parents and students understand what's available. And then I think it's SB 98. If you think about with LCAP, the new buzzword now is learning continuity plan, and districts are required to put in their plan of how they're going to meet, I believe, how identify the type of professional development and resources that's available for staff and for students. So that's going to be part of their LCAP, the learning continuity plan. So they're finding different ways too to there's all these resources, but really those two legislations I think are going to be that's pretty cool. That's great that's something that is going to be, it's part of their plan if it's not already submitted.
Yeah. So. And a lot of what we do is help districts kind of synthesize all the resources and information are out there and create guides for them. So we have a countywide suicide prevention resource guide for schools. And with the passing of AB 1767, it's now saying elementary schools have to have suicide prevention policies in place. So we created a guide for elementary districts. And so a lot of our work is helping districts meet the requirements of legislation. And that's where our services create those, I don't want to say products, but resources.
Because that's important. I mean, we're here to assist them. And I mean, there's no way that they could go to all the different meetings, all the different committees that we're a part of in San Diego, like Heather across the state. So we try to bring whatever is relevant and could help them meet the legislation. We've really tried to make sure that we get that out there, create guides that are easy for them to navigate. So that way, because at the end of the day, it's really, we want to make sure that the needs of the students and also staff get met.
All right, so I will now call for a 2-minute pause to allow the public to submit any comments on the item before the commission moves into deliberation. Commissioners, as a reminder, please refresh the view on your screen to ensure the new comments appear. Sorry, did I hear someone say something?
Yes, will staff please display the public comment and start the timer? Thank you.
I'll apologize if it's difficult to read. I have no idea why the color is not coming up, if it's not coming up on your screen, because it's not on mine.
It's a little pale, but you can see it. I can see it. All right. Will the staff display any public comments?
No comments were received. Thank you.
Okay. Do any commissioners have any comments or questions now? Nope. Well, thank you, Heather and Violeta, for your time. It was a great presentation and hopefully something that we can put into our school system sooner than later. Like you said, with everything going on, it's definitely needed right now. So thank you very much for your time. You're welcome
Thank
to
you
stay
for
for the
having
meeting.
us.
I don't know if you're gonna log off or not, but thank you for being with us.
Thank you
so
very much. Good night, good evening. Bye.
Bye. All right, so the next item on the agenda is item number 3, growth management quality of life metrics. Kimberly Elliott, Facilities Financing Manager, will provide an overview of the Growth Management Oversight Commission's efforts to establish new quality of life metrics and solicit feedback from the Commission on potential public health metrics.
Hi, everyone. My name's Kim Elliott, and I'm the city's Facilities Financing Manager. I'm fairly new to the city, and I'm going to have Kim Vanderby, give you a little background on the whole growth management program and the commission, and then I'll jump into, she'll give you the history, and I'll talk about where we're moving and taking this whole concept and what we'd like your role and assistance to be in the process. So Kim, I don't know if she.
Thank you, Kim.
Oh, good.
Are you able to hear me? Great. So sorry for the confusion. There's 2 Kims here. I'm Kim Vanderby, and I've been the project manager for the GMOC for the past 13 years. Believe it or not, our growth management program is 33 years old. It started back in 1987, and that was in response to growth steadily occurring in eastern Chula Vista. There was a serious concern that poorly managed growth could strain the city's ability to provide public services, worsen existing traffic problems, and basically lead to an overall reduction in service levels and the quality of life of its residents. So the City Council adopted an ad hoc committee to develop quality of life threshold standards for the city. The concept was to establish performance standards reflecting the current or desired levels of service, and then measure the effects of growth against those standards each year. In that way, the city could use the standards to evaluate its ability to meet the quality of life objectives at the build out of its general plan, and also monitor the standards annually as growth occurred to ensure that they were being met. The ad hoc committee consisted of representatives from community groups, the city's planning commission, and the development committee, and they met several times over a period of months. And then they selected and defined the threshold standards for 11 topics on the slide in front of you. And they are police, fire and emergency medical services, schools, libraries, parks and recreation, water, sewer, drainage, traffic, air quality, and fiscal.
Stacy, there you go. Jump at the gun.
The air quality is now called air quality and climate protection. That change was done about 5 years ago. So essentially, for nearly 20 years, there were no significant changes to the program. But back in 2005, when the general plan was updated, Council directed staff to do a top to bottom review of the growth management program and to take another look at the threshold standards. So it took about 10 years to get that accomplished. There were staff changes, loss of consultants, the Great Recession. But ultimately, back in 2015, there were some changes to some of the threshold standards, which are codified in our growth management ordinance. So fast forward to 2020, things have changed a lot in the last 5 years or so, and Council directed staff to take another look at these threshold standards and really focus on the quality of life, which was the origin of this program in the first place. Its preservation of quality of life lies at the heart of the city's growth management program. And the whole reason for it was to assure that new infrastructure and public service would be delivered concurrently with development to maintain or improve levels of public service for the residents and businesses in Chula Vista as growth occurs, to maintain the city's fiscal well-being by assuring that new development pays its proportional share of infrastructure and service costs, while it strengthens the city's ability to sustain high-quality municipal services, and to assure that growth does not negatively affect the public health, safety, and welfare, or diminish the city's ability to achieve its urban development goals as expressed in the general plan. So recognizing that there are several other committees and commissions, such as your commission, that didn't exist when the growth management program came into existence, we realized that some of these other commissions are looking at some quality of life issues, and perhaps we can learn from you and collaborate on some quality of life metrics that would be more relevant to our current growth management program. And so Kimberly Elliott is going to introduce you to some ideas that we've started discussing with the growth management program, and would love to get some feedback from you.
Thank you, Kim.
So Kim, sure.
Stacy, if you could advance to, so you saw the old list of topics, and previously the growth management plan or program had a tool, and that was actually a building moratorium. I don't think the Chula Vista ever had to do that, but they were able to actually stop building houses if certain thresholds weren't met. With all the new housing regulations in the state, cities can no longer do housing moratoriums because we're in a housing crisis and we need housing so bad. But also the city, this plan worked. It did its job. My group collects all the development impact fees for the developers, and they are building the facilities and the roads and the fire stations and the parks concurrently with the build out of these big master plan communities. So It's done its job, and now we want to shift the focus to overall quality of life within the city. So these are the new topics that staff has proposed, and we've been discussing with the commission, all of the Growth Management Oversight Commission. I think we've had 3 or 4 meetings on these topics. And what we're doing is bringing staff and department heads into these meetings to give presentations on what their group does, and then we're going to go back so more of an education process right now, then we're going to go back to the departments and talk in more detail about metrics. So that's what we're doing here tonight with you all. And the first one, instead of just having police and fire separate, I combined them all under public safety, and we added emergency preparedness as being an important thing to look at for quality of life. We never had just housing before, and we thought that, we're in such a housing crisis and affordability issues that we should take a look at that on an annual basis. We used to have traffic, but now we're going to call it transportation and land use, and look at the types of developments that are moving ahead and how we can best reduce reliance on single occupancy vehicles and use transit, and also want to include safe streets as a topic as well. The next I'm calling connected communities, and that will incorporate parks and rec, libraries, arts and culture, and education. And then the next slide, thank you. Economic development is also a topic that was not included previously, but certainly creation of small businesses and employment levels, public facilities should not be on there, should all be looked at as a thriving city on an annual basis. Sustainability, and of course we have our climate action plan, so we should be looking at these are possible topics that we would look at: air quality, energy, greenhouse gas emissions, water conservation. And then where you all come in is health and wellness, and I'll go, the last one is smart city. The city has pretty aggressive innovation goals and program where we're looking at making the city transparent and connected with technology. So back to health and wellness, what we wanted to do was really engage you all in what are the factors that we should be looking at and measuring to determine whether we have a healthy city or not. So these were just thoughts that we had: was access to healthcare, maybe some type of metrics like, heart disease or diabetes or obesity, some things like that. And then also the healthy aging idea. So Stacey, I don't know how you want to kind of kick off this conversation, but we'd love to hear from staff and the commissioners on your thoughts on how we might, what metrics you think we should be looking at, what things you guys are working on that you think are important. And what we'd like to do is have Stacey come to the growth management meeting next week and share your ideas with the commission. We on Thursdays.
Thank you, Kim and Kim. I think you guys did a great lead into it. The only thing that I would add before the commission starts the discussion about it is that when the Kims came to me and talked about it initially, one of the things that I asked was, is this a metric that we want to compare to other cities of similar size or cities within San Diego County? Or is this a metric that we would want to do something internally within the city so we could even compare neighborhood by neighborhood? And the answer is that's all up for grabs at this point. So that's something else that I want you to consider as you start this discussion is what should we be measuring ourselves against? And that also helps drive some of the metrics that we might use, because sometimes we only have a metric at a city level or a county level versus a census tract neighborhood type of level. So with that, Lucia, please go ahead and initiate the conversation. Oh, I think I muted you, Lucia, so you might need to unmute.
You did. There we go. So I was saying that one of the things that popped into my mind to kick off this conversation is I know there's a housing crisis, and something we've discussed in the past as a commission was health equity, as far as kind of green space or parks being added to whenever there is a new area that's developed kind of on the west side. And, you know, yes, we know that on the east side, this is the reason this was created, and there's always a park, there's always an open space, jogging area, trail, something like that. And on the west side, just because of the way, you know, the city is already organized, it's hard to do that while also taking up the land for needed apartments or housing. But I think that's still something that's really important to continue to not only beautify, but, you know, keep it safe and keep it a place where people do want to walk around. Because it can vary from street to street on the west side where, oh, this street's nice, there's some nice houses here, and you go next one, you're like, oh, I don't know if I feel that safe. And not for any reason other than that's just the way it's been built over the years, because it is an older area. So I think that would kind of tie into several of the health and wellness metrics that we'd be looking at.
Yes, this is Anna. I agree with what Commissioner Martinez is saying. I also want to add that I think access to healthcare is very important. You know, right now we're living through a pandemic, and what we find is in the South County where Chula Vista is located, there is a disproportionate amount of infected residents as well as deaths in our zip codes, especially 91910, 91911, which is the West. And what we're seeing is many times people are not connected to permanent medical home. And so what happens is when they get sick, by the time they get to a healthcare provider, it's too late, and they end up dying at home. And they also end up unintentionally infecting that multi-generational and overcrowded home that they live in. Because as we all know, housing is a cost burden for many of the families. Many are still working through this pandemic as essential workers to pay rent. And so what we do is definitely find a way to get more, I think, active in getting people tied to a medical home now more than ever. And this will allow people to have better chronic care management as they do age. And the more we can also help with preventative care, the better. So I think that's a very important lens to look at.
Hi, this is Mary Cruz. Can you hear me okay?
Yes.
Okay, I was just going to suggest that you mentioned looking at what perhaps were the illnesses or the things that we need to take care of. And you had mentioned, you know, is it asthma, diabetes? Actually, both of your local hospitals have those reports. They do them every other year. They're community benefits reports. They are public documents. They are have to be given to the Attorney General, and they're on both hospitals' websites. And they would easily tell you, they track the type of care that is being provided for what illnesses, et cetera. It also includes the projects or programs that the hospital is doing to address those specific areas, because that's their mandate as far as community health. And also the county health department has tons of metrics on what diseases and illnesses and ages, et cetera. So you have those available to you already without having to do any further research, I would think. And what Anna is mentioning is another one of the pieces of what happens at the hospitals is that they are trying to find a home, medical home for these patients. As you know, the cost of going into an emergency room and receiving care, not only if it's a late stage, it's harder to do, but you know, they want to find a home for these people to bring down the numbers of emergency room visits that aren't really necessary to be in an emergency room if they would be able to maintain their health as all the things that Anna already mentioned.
Yeah, I think that's great information. Before I forget, one of the most alarming statistic that the county projected, I want to say 7 years ago, and it hasn't changed much. It would be good to see what the update would be. Was that a child born, a Latino child born in the South County, 1 in 2 will become diabetic by the time they reach adulthood. And so I know the school district, elementary school district, took that to heart, and they have a great wellness policy in the school district that's shown progress and good positive health outcomes. But so that infrastructure is there, but it definitely has to. That's kind of a good start, but there's still a lot of work to be done still in that area.
Hi, this is Liz. All hear me?
Yes, we can hear you.
Okay, great. So as a health teacher, I teach my students about the leading causes of death, and the 2 risk factors. Well, actually, I can talk about teens as well, but for adults, the 2 main risk factors that lead to the top leading causes of death are poor diet and also smoking. And as we know, vaping very often leads to smoking. So I would suggest including like food security and access to good nutrition somehow. And then also, I mean, we're going to look into doing some type of study into like teen vaping and smoking statistics. So I would definitely include those. And just on the side, the leading causes of death for teens, the main risk factor there would be drug and alcohol abuse. So maybe we can include in our survey to the teens, to the high school students, some questions about that, or just use some of the Healthy Kids survey results that they were talking about earlier from the County Office of Education. We could access that information specific to South Bay schools.
One of the, this is Mary Cruz again. One of the other things that I've seen, and I know we've tried to compensate and make that better in our planning, in our growth planning, is fire department and police services. I mean, we had a huge amount of growth in eastern Chula Vista. We put in schools with metrics on how many homes, then we need another school, but we didn't do that for fire and police. And as we all know, we're still lacking, out in the eastern portions of Chula Vista for that. And I think that has to somehow be included in the growth management. If we're going to put in X number of homes, then we need another fire department, or we need another fire engine to be able to go out there. It is a health issue. It is concerning if you call 911 and it takes them 20 minutes to get there. In the meantime, you've died of a heart attack or a stroke. It is something that we need to look at. And I realize that in some cases it's too late because the buildings have already gone up and the homes are already there. And where do you put in a fire engine, right? And the cost. But I think it is something that does need to be looked at as well.
Kind of going along with that, I guess in the bigger picture, something we've talked about in the past as well was, and it got me thinking with what Commissioner Cruz was saying in the number of hospital beds we have. I know that they extended Sharp, but we have the 2 main hospitals here for real true emergency services, and they keep building homes, but there's no added hospital emergency service. We know that our Kaiser people have to go all the way up to Zion is the closest one. And so Scripps and Sharp being the 2 main ones. So I know that's always been a topic of concern for us as a committee.
Yeah, that's a great one to bring up, Commissioner Martinez, because especially right now with COVID, you're seeing our emergency rooms severely impacted. And so what we find is that even before COVID, they were already impacted, and with it, it's much more dire. And so just for me, I remember experiencing an emergency in the morning and trying to drive up to Kaiser. It was terrible. It was, the traffic was bad, and we had to do a U-turn and come back to the South Bay. And my biggest fear was, is my insurance going to cover this? It wasn't even so much a matter of my life, but it was, what bill am I going to get? And I feel like that's an unnecessary stressor as someone's trying to recover. And so that's definitely a disparity right then and there.
Yeah, I would totally agree. My name's Alan Rodriguez. I'm actually a primary care physician here in Chula Vista. And every item here on the growth management metrics, all 8 categories, I can see obvious ways that this committee can weigh in on what metrics we think. We've already mentioned public safety and emergency preparation just now. And yeah, I work here at one of the local hospitals, and we were on bypass, meaning every possible bed was full at the peak of the pandemic for multiple months. As soon as we discharged one person with COVID, another one was there to take their bed. And we had to send people out from our community to other communities to take care of them. And in thinking about growth management, that is obvious. But in terms of your initial question, should we compare different neighborhoods of Chula Vista? I think that makes sense in terms of growth management, not just to look at the newer communities that are being built, but also make sure that the older parts of town meet probably certain minimum qualifications as well, or at least have standards or goals to reach for. And then we could easily compare the city as a whole to other cities of comparable sizes, I think. In terms of the health and wellness section you were talking about, and specifically healthcare access, I think we could divide that like Commissioner Melgoza said about, does the patient have a medical home? Is there someone they identify as their primary care provider, or where they would go in an emergency or non-emergency? But also in access is, can they afford their medications? Can they afford their copays to see the doctor? Not only do they know where to go or know what they should be taking, but what percentage of their monthly income goes towards medical costs? Is that appropriate or not? Is there things we can do to address that? And then health metrics, I think, was spoken about well. I think childhood obesity and adult obesity are really big ones in our community and lead to a lot of downstream effects. Access to healthy food would go maybe there, or maybe under some of the other metric categories. And then healthy aging, probably life expectancy in general. And I think healthy aging, we'll have other meetings coming up in the next month or so, where we can talk about that more in depth. But thinking about all the other categories, probably how does each category, like connected communities, how does that look like for a kid versus a young adult, middle-aged adult versus an elderly adult? How can we keep all different demographics engaged is probably important to consider.
This is Maura, and I would also like to make sure that we do have an emphasis on the mental health aspect when we're talking about health. I mean, we had the big presentation already, and just having the resources available for our residents. I did mention South Bay Community Services because I have been involved with them for a long time through my company, and I know that they have a lot of good services that they offer to our residents, and just making sure that I guess, general information, right? So people know where to go, resource guides and all of that, and expansion on that. And as far as the housing, since that's kind of my industry, I definitely agree. And I'm sorry, I don't remember who mentioned it. I think it was Commissioner Mendoza on the fire and police. That there are some lengthier response times I live on the east side, so I'm only speaking about the east side. However, as a developer representative, we do have a lot of development impact fees that we are required to pay with every new development. So we are contributing. So I don't know. I know it's definitely a good thing to look at because it is a need, but we are already contributing. I just wanted to make sure that everybody was aware of that. That's through those development impact fees that Kim talked about. But I think there's definitely so many good topics, and I'm really happy that you're taking a look at the healthy aspect for our communities. Thank you.
Thanks, Maura. One question, and maybe this is for Alan, is when we talk about access to healthcare, like, what's the solution? Or what does that look like to have access to healthcare? What can we measure? Like number of people covered by insurance, or what are your thoughts on that?
Yeah, and Commissioner Melgoza might also have some ideas on that because she's worked in a very large federally qualified health center here for much longer than I have. But yeah, initial thoughts, and I'm not sure exactly what means are you going to be using to do the measurements to begin with? Is this survey or publicly available information?
I don't think we do annual surveys, but so mostly we do them within the city departments. So I'm not sure how that would work going outside of the city to the different, hospitals, but maybe it's publicly available information.
Yeah, so what I would add to that is that I think the goal of this is to find out what we might already be doing as a commission and what we're already looking at. But then also beyond that, are there certain things that just really dictate quality of life for somebody that we should be looking at that maybe we aren't collecting or looking at right now? So I think it's kind of both. But I think in general, probably things that are out there already that we know are collected on an annual or biannual basis are going to be the most likely things that the GMOC would probably want to have come forward.
Hospital beds was already mentioned. So that's you could do a per capita hospital bed. You could also do per capita like physician. If there's a healthcare provider shortage area, those are also reported nationally. I don't know the details of our census tracts, but how many doctors, nurses per capita do we also have available would be one measurement.
So just to kind of start summarizing what I've been hearing, since I'm probably going to be the one reporting out on this next week. So I've been hearing some things about just kind of general like basic needs, meeting basic needs. So maybe some type of poverty index or something that gets to being able to afford medications and potential food insecurity issues. So I'm hearing that. I'm also hearing about not just access to healthcare, whether it be insurance coverage or something along those lines, but access to emergency services and potentially like specialty services, because that's something else that often is talked about in the healthcare industry about special availability of specialists. So that might be something to look at. The aspect of some of the kind of health metrics that I'm hearing is diabetes, mental health, obesity, So those are the big things that I've been hearing.
But Stacy, include cancer. South County has one of the highest cancer rates in the county and in the state, actually.
Okay, and then I think the only big things that I'm probably missing are the drug and alcohol, poor diet, smoking, and I'm still trying to wrap my head around what metrics we would use for that. There's definitely smoking rates. But I'm just thinking what we went through with the vaping and how that translates to quality of life from a community perspective. So I'm still kind of
Also
around some
asthma.
of that. Yes.
Asthma rates might be connected to that too, Stacy.
Yes, and I do want to also point out that you guys had a presentation from Corey Downs from our conservation department a couple months ago about the health equity index for our climate action plan, and so we're going to also be working with him to see where there might be overlap in some of the data that you might use. So, like asthma is a perfect example of that.
One of the other things that is high in South County and actually in all the county is Alzheimer's. And, you know, insurance doesn't cover care for Alzheimer's. So that, you know, fits into so many different things as, you know, care for the person, you know, coverage for that person. You know, does somebody have to quit working to stay home and take care of grandma or grandpa? You know, it is and then also almost all of the diseases that you already described actually add to or are risk factors for Alzheimer's.
Is there a way to also measure like disability status? Like is someone on permanent disability? At what rate does our community compare to the other communities?
Yeah, that's a good point. You know, if I can just take the opportunity, this is Commissioner Malgoza. I think what we're creating here is really good because what we're seeing is we're definitely using the health lens, right, for growth management, which I think is powerful. I just want to add to that we also look at equity and also cultural proficiency. And what I mean by that is it's great that we write these words down, but in implementation of how we create this culture of health and continue to create one with city operations, informing policy is important. So as we talk about these priorities to define this growth management, that we also do it in an angle that really connects with the people that live and pay taxes in our city, be it, you know, multilingual, and also be it so that it's accessible by the people. People are understanding it. It's really connecting with our residents so that they understand what we're trying to do and why we're doing it.
Yeah, what metrics are important to the community is also very important, I think.
Okay, so why don't we go ahead and looks like we gave several comments from both staff and commissioners. I'll call a 2-minute pause to allow the public to submit any final comments on the item before the commission's deliberations. Commissioners, as a reminder, please refresh the view on your screen to ensure new comments appear.
Staff, please display the public comment and start the timer.
And if I could just talk for a second during the 2 minutes, thank you so much for your input. It's very, very helpful and enlightening. So we may, Stacy's going to come to the growth management and share what you shared tonight, and we will come back to you and talk to you about some of the, you know, as staff will try and come up with metrics and then share it with you again before it goes into any ordinance.
And Kim, I don't recall if you indicated the time frame or not. I apologize, but like when would we potentially expect to have you come back to this commission?
Let's see.
Sorry to put you on the spot.
No, that's okay. It might be, do you meet once a month?
We typically meet every month, yes.
Yeah, I think it'd be after the first of the year.
Okay, thank you.
All right, so the commenting period for this item is now closed. Were there any questions that came up or comments?
Comments were received. Thank you.
Okay. Do commissioners have any comments or questions now? All right. Well, thank you very much, Kim and Kim, for joining us. You're welcome to stay, but if not, like Stacy mentioned, hopefully we'll hear back on what the agenda will be for the next time.
Thank you for having
All right.
us.
Thank you so much.
Thank you. Bye.
Bye.
Okay. So the next item on the agenda is item number 4, e-cigarette policy work and youth prevention. So Stacy Kurt, Senior Project Coordinator, will provide an overview of a work plan to address use of vaping products, and the commission will provide guidance on policy actions.
So I didn't get as far as I had hoped on this particular agenda item for you tonight. I had hoped to bring in potentially a speaker or so around the education piece, but I hope that I can still get some good guidance from you as far as what you'd like to see going forward. So just as a little bit of background, I wanted to make sure we were all up to speed on what has happened over the past year within Chula Vista. So back in February, the commission made a recommendation to City Council that we prohibit the sale of flavored tobacco products within the city of Chula Vista, and also that we put a restriction on electronic cigarette products that did not have FDA marketing orders. As you know, since that time, the state has taken action along these lines for flavored tobacco products as well, as you heard last month in the presentation that we received from American Heart Association. So we went to council in late February of this year, and the city council chose to refer back to staff to get more information before they took action. And this, again, was prior to the state taking action on banning flavored products. So at that time, the city council indicated that they wanted to know a little bit more about what type of tobacco retailers existed out there. So differentiating between a grocery store versus a liquor store versus a 7-Eleven that might be selling these types of products. And then they also had asked at the meeting to provide what % of their sales were related to tobacco. And that's probably a difficult number to get at, but certainly we could look at the types of retailers that exist out there that have business licenses to sell tobacco and give them a sense of that. They also wanted us to map concentrations, which you can see here to some extent on the bottom of your screen is a map of the licensing that we have for tobacco retailers. So that does give you a sense of the concentration, but we were going to overlay schools and other sensitive resources on top of that map and get some more details around it. And then also they wanted more information on local access. So we presented at the time that we went to council some information about national statistics on how students access, whether it be a retail store versus online sales. And the city wasn't really comfortable, the council wasn't really comfortable with just using those national numbers. They really wanted to know more about our local retail market and how many children in our community said that they were accessing it through that retail means versus an online means or something else. And so after that, I started preparing to do some student education, as we talked about last meeting, coupled with some surveying so that we could drill down on some of these items that the city council wanted to hear more about. And then COVID hit. And so we took a pause to try to figure out how we were going to do that with a virtual world that we were now in. But now that school's back in session, and everybody is online now, and we hope have access to devices and is actively participating in their school. I think the door is open again for us to look at this and revisit it. And so there's two things basically that I want to get guidance from you on. The first is education. So we certainly could look at doing some virtual education for both students and parents and working with our school districts to provide that. There is through Stanford Medical, there is a toolkit for tobacco prevention. We have some locally trained professionals that can provide that education. That's who I'd hoped to get here on our call today, but probably better for timing that we didn't. So certainly if we're interested in exploring that, that's the most likely people that we would lean on to help provide some education here locally. The second piece that I'd like to get some guidance on is how far we want to go with additional policy research, mapping the concentrations, looking at the tobacco retailers, et cetera, considering that the state now does have a flavored tobacco ban in place. But you did hear the uncertainty of that and the length of time that may take at our last meeting. So considering all that, is there something in the policy realm that we want to do locally here in the meantime until the state does or does not put into effect the ban on tobacco, flavored tobacco? So with that, I really want to open it up to the commission to get your guidance on the education and the policy, see where you would like me to head and where you'd like me to focus my time on in the next coming months. So that concludes staff's presentation.
Thank you, Stacy. I do have a question. So it sounds like we were looking at banning based on retailers and, everything you mentioned for, even flavored products and vaping. And then now it's looking like we have education to do, but didn't we already have education in play? Because we had the American Cancer Society come talk to us. And I think someone from the school districts, came to talk to us as well. So is education something that we really need? I know we have the toolbox, which is great. I mean, the more the better, but is that something that we need to focus on at this time?
So, I mean, that's really up to you and what you're seeing and feeling. You do have a teacher online too as a commissioner, so she may have some valuable input into this. But I think, I think you heard earlier in our conversation from the San Diego education that a lot of this stuff's on request. And so if a school doesn't reach out and request something, they're not always going to get it. And we found that even with the QPR training for suicide prevention, that it wasn't coming to the South Bay just because we weren't asking. But a lot of these services are out there free. And so it's just one of those things that if we think this is something that we need here in our community right now, it's something that I can work on to try to get some of the free resources. And then if we need to go beyond that, we can have further discussions. But that really, I want to pose it to you as where you think our time should be spent at this point as a city.
Well, I think that's a great point, because I was thinking education of the students having it, but not thinking that they weren't getting it if it wasn't being requested. So, yeah. Commissioner Murphy, do you have anything to add?
Yeah, so the county does offer a vaping education training, which I attended last year. But I don't know if necessarily all of the health teachers in our district attended it, but it was offered and promoted by the health resource teacher in our district. So, I mean, we do have access to education programs, and Obviously, it is a topic that is covered by health teachers. So I don't know. It's just up to everyone. I mean, I don't think it would be absolutely necessary, but at the same time, it would be useful. And you know, the more resources that are available to teachers, the better.
And Liz, let me just ask you, or Commissioner Murphy, excuse me, from a perspective of what you see for the parents and the students, do you think that there's room to provide additional education to them?
Oh, yeah, absolutely. With the parents, absolutely. I think more parent education is needed because our district really hasn't taken that taken on that role of educating the parents much about vaping. So that would be an area of need for sure.
Yeah, this is Mary Cruz. I would have to second that. I feel that the schools are doing a good job at you know what they can do, what they have available, but I'm not sure parents realize the dangers of vaping. They may also think, you know, what the commercials are telling you. Well, at least he's not smoking a cigarette. This is better, and in fact, it's not. And even the consequences of vaping aren't completely all there because it's such a new thing. So I'm not sure how, but I would like some emphasis on parents. You know, right now with the COVID life we're living, it's hard, but I would think in the future, if you know things go back to somewhat normal, you know, at places where parents may gather to provide education and information, you know, is it, you know, at the local parks that may do classes or may do programs on you know available, the library. I mean, where can we access folks and be able to provide this education? Is it the grocery stores? Is it pamphlets at the grocery store that, you know, go in the bag? You know, there's different ways. I think that if we think about where do parents gather, that we can provide this education.
I think through the school districts, and that would be a good place to start, you know, advertising parent education opportunities through the school districts, even the elementary school district as well, you know, starting with the sixth graders, for instance, and the middle schools especially, and the high schools as well. Yeah, because parents need to be able to recognize, because, you know, a lot of the vaping devices, you know, you can't tell what they are by looking at them. They look like pins. They look like, you know, markers. They look like, so if parents are educated as to the warning signs and what to look for, you know, they can be a little more proactive in helping their students avoid that issue, that problem.
So what are some next steps that we should have for Stacy then? Any recommendations? We said taking them out to parents or trying to get access to parents. That's one for sure, to educate parents on this. Anything else?
Well, I think maybe communicating with the district leadership, you know, the South Sweetwater Union High School District and Chula Vista Elementary School District leaders. I know the health resource teacher for Sweetwater Union High School District. I can probably get a hold of someone from Chula Vista as well. So I think just having a conversation with them and discussing the possibilities be a good start.
Commissioner Murphy, would you be willing to introduce and join me in a conversation with Sweetwater?
Absolutely, sure.
As far as Chula Vista Elementary School, I actually sit on the wellness committee as a parent representative because I have two children in the elementary school district, and we have a meeting next Wednesday. So I can certainly bring this up to them as an area that we'd like to explore with them and providing some education for parents.
Great.
Do we have a grant or anything where we can incentivize either parents or the schools or anything like that, along with the vaping or cancer society or anything like that, that would kind of, you know, provide a challenge to the school that gets the most parents involved, or I don't know, just some type of incentive for this, because everyone's virtual right now, so I don't know.
Yeah, we don't have any monetary incentives. I mean, that's certainly something that if this commission wanted to look at some grant opportunities, we could certainly do that. But what we have done in the past to reward schools for participation and things. So for instance, for Love Your Heart Day several years ago, and I think this is just when the commission was formed, we asked all of the middle schools to provide locations for blood pressure checks. And the school that had the highest number of blood pressure checks was given an award at city council. So we actually did a banner for the school that said that they were the golden apple winner of the Love Your Heart Day or something along those lines. So, but of course, banners cost money too. So we were able to find some funds to be able to do that at the city through, I think, our communications department at that time. So I certainly could try to do something along those lines again. But something more is always better as well. So I'm hearing the parent education is something that we do want to pursue. I'm not hearing anything about policy at this point, so I'm going to assume that we're okay with letting things happen at the state level at this point, unless I hear differently from you. So that would mean that I would not be preparing anything to take back to council at this time.
I guess not. I think the only thing is we think that the tobacco companies are going to get enough ballots to delay the actual law, right, for another couple of years.
That's what we heard. And we do have a couple of people on the line as participants, as attendees today that I'm sure are going to chime in on this particular item. I think that's why they're online with us. So if they have some additional information for us about what's happening at the state level, that would be wonderful. You can put that into the e-comments for us.
I think probably our recommendations from before, as I understand it, would still stand, that we would still support local ban or tighter regulation of these flavored products. If it's happening at the state level, great. If it doesn't happen, I feel like we should still support it happening here.
I agree. I mean, we could be a model city for this.
I agree as well. I mean,
so now I'm hearing that you do want me to pursue doing some of the policy work around it. So what I will do is we have a full agenda for next meeting already, and it's going to be a joint meeting with the Commission on Aging. So for either our December or January, my goal will be to bring back some additional information that had been requested at the City Council meeting. And assuming you don't have any additional information that you think is pertinent, if you do, please let me know now, but otherwise I'll just pursue what the City Council had asked for additional information.
Yeah, I don't think it's exigent. I think we have several months to work on this.
All right, so I will now call for a 2-minute pause to allow the public to submit any final comments on the item before the commission deliberation. And commissioners, as a reminder, please refresh the view on your screen to ensure new comments do appear.
Will staff please display the public comment and start the timer?
All right, and commenting period for this item is now closed. Were there any comments for the commissioners to read?
No comments were received. Thank you.
Okay. Do commissioners have any final comments or questions? Okay, we're going to go on to, I think, the final agenda item. We only have a few minutes, but I wanted to make sure we get to it as well. So item number 5 on the agenda is Chula Vista Health Heroes. Stacy Kurtz will present materials for the first annual Health Heroes Award, and the commission will establish a schedule for the award cycle.
So I won't go ahead and do any type of presentation for this. I'll just say that you have received it in your packet. So hopefully if you had a chance to look at it, some of you are seeing this for a second time because we tried to launch this right around March of last year. But I think more than ever, this is pertinent in our community to reward those people that are going above and beyond during these crazy times. So if you have any comments on the documents that were sent to you, and if you could provide me with some type of indication of when you'd like to see us actually go ahead and do this, if we want to move forward with this, I'd appreciate it.
Any staff or commissioner comments? Yes. I think it looks great.
Okay, well, if there's no additional comments, is there a particular time period that we want to launch this? I mean, before we had kind of aligned it with the elementary school district's timeframe, which was kind of like February to April. So we could go back to doing that, or if it's something you guys want to launch now, I just think we should be consistent on an annual basis of when we're putting it out and awarding it.
I think in the spring would be good, you know, kicking off 2021, going back to February, because I think the holidays and everything's going to be a little mixed up right now. But I mean, I would hate for it to wait that long too, because it is so pretty.
Yeah, I agree. It's really sad because of COVID. I can't remember what month I was in right now. But yeah, spring works out good.
Okay, so we'll shoot for a launch in early 2021 then of getting it out for the application and awarding it sometime around April, May.
Yeah.
Okay, that was the guidance that I needed. Thank you.
Thank you. Do you want me to go into the 2-minute for this as well?
I think we need to for every item.
Okay. So I will now call for a 2-minute pause to allow the public to submit any final comments on the item before the commission deliberation. And as a reminder, please refresh the view on your screen, commissioners, to ensure new comments appear. Thank you.
Thank you. Will staff please display the public comment and start the timer?
All right, the commenting period for this item is now closed. Have the commissioners had enough time to look at any comments, if there were any?
No comments were received. Thank you.
Thank you. Do commissioners have any comments or questions now? All right, so the next item is other business, item number 6. Any staff comments, chair comments, or commissioner or board member comments?
I just have a couple of quick items. I wanted to let you all know that this past weekend, the city started a new COVID-19 testing site at the South Branch Library. So the city looked at what was available as far as state and county testing sites already and identified a gap in the evening hours. They also identified that most sites require an appointment, and then also that there was no service provided on Sundays. And so the hours of operation for this new site, which is being run by our fire department EMTs, is Sunday through Thursday from 12:30 p.m. to 8 p.m. And again, no appointment is required. And it's a drive-up service. The second thing that I wanted to just remind you of is that we had an ethics training live course last week. If you weren't able to participate in that or have any questions about when your ethics is up or how to take it to get your credit and your certification, please just contact me directly. Once you take it, it is good for 2 years from the date that your certification is filed. So if you attended last week, that is your date. 2 years from now, in October of 2022 would be the next time that it would be due for you. And then finally, I just wanted to confirm, I know at the end on our adjournment, it had a time and date to be determined or tentative on the Commission on Aging joint meeting for next month, but we have confirmed that they have a quorum for next month. So we'll be meeting with the Commission on Aging on November 12th at 4 p.m. And that concludes staff's comments.
I don't have any chair comments. Any commissioners or board member comments?
I would be remiss if I didn't encourage everyone to take their flu shot. We don't want a twin pandemic.
Good point.
And to vote.
Yes.
Very important. Voting leads to better health. That's true.
There you go. No, okay. So I will adjourn this meeting. And it is now 6:05 p.m. I'm adjourning this meeting to a special joint meeting with the Commission on Aging tentatively scheduled for November 12th, 2020, as Stacy said, at 4 p.m.
Thank you, everybody. Have a great week.
Thank you, everyone.
Bye.